Hello, this is Dr. Alexiades presenting on the prepping and draping for anterior total hip arthroplasty on a standard OR table. This is our instrumentation, including our curved retractors, right angle retractors, elevators, mallet, but also the gripper, which is the white device with the blue button and the two hooks attached, and our draping systems, which are seen on either side of this Mayo stand table. What you'll see is also the additional instrumentation here of our Concise, which is where the green light is shining, followed by its attachments down below, and then for the dual mobility, the instrumentation for inserting. Here's our gripper with its two hooks and its blue button. This gets attached along the left side of the patient, where you see two metal posts with a little white plastic at the base. This gets attached after the patient is prepped and draped and after we're ready to perform the femoral part of the procedure. And this is the view from the foot. We prep the legs, put a sheet down. Once the sheet is down, we use a couple of sterile towels to hold the feet up. This will then allow the scrub tech to come in with the Easy Suit system. Basically, that gets slid over the toes. These built-in stockinettes then sort of get shoveled down over the feet. And once the feet are covered, then it's easy for the scrub tech to grab both feet from the heels, keep the legs elevated, while the two assistants on either side will then start to shuttle the dressing down to the top of the legs, and cover the foot of the bed. This is then followed by placement of the Steri-Drape portion onto the surgical site. We remove the paper over the sticky drape, and then the sticky drape is very carefully placed right over the surgical site, which was pre-marked with a surgical pen. Once this is stuck down, then the rest of the drape can be opened to cover the arms and the head. We put stockinettes over the legs because the stockinettes of the Easy Suit are kind of bulky and loose, and this helps neaten things up and also allows for removal later on in the procedure should the foot be lowered and need decontamination. I check the leg lengths there. I also put a bump underneath the knee. On the surgical side, we put plastic drapes up to protect the anesthesiologist, and we're done.